not depressed. So my name is Anne, that's Sharon, there's Natasha, Julie, Mamta, Jamian, Yet, and Ethan. Okay, so we're gonna talk about depression, but before I start talking, I'm gonna show you a video. This is just like a minute video. So, yeah.
Many things can trigger debilitating depression. Feelings of depression are caused by a chemical change that affects how the brain functions. A normally functioning brain is a giant messaging system that controls everything from your heartbeat to walking to your emotions. The brain is made up of billions of nerve cells called neurons. These neurons send and receive messages from the rest of your body using brain chemicals called neurotransmitters. These brain chemicals, in varying amounts, are responsible for our emotional state. Depression happens when these chemical messages aren't delivered correctly between brain cells, disrupting communication. Think of a telephone. If your phone has a weak signal, you may not hear the person on the other end. Their communication is muted or unclear. The good news is that there are many forms of treatment that can help you cope with depression, including medications that can strengthen weak signals by raising the levels of certain neurotransmitters, or by improving the neuron's ability to process signals. This ensures that the brain's vital messages are delivered loud and clear.
Okay. So, we have a case study number 2, that's Robert. I'm just going to read about his case. Robert is 23 years old, male, and he was brought to the psychiatric emergency room following a suicide attempt. When interviewed by the psychiatric nurse, Robert was reflecting and convincing in describing the suicide attempt as an impulsive, insignificant gesture that he now regretted. He stated that he was sorry that others had mistaken his actions and overreacted. Robert told the nurse that he would call his therapist for a crisis appointment and that he had just wanted to take a shower, go home, and apologize to his family for causing problems. After speaking to his parents, he learned that they feel exhausted from constant worrying about him and voiced concern that they state that Robert has been unemployed for 4 months and voices feeling hopeless about ever finding a job. He seems to have been deteriorating since the breakup with his girlfriend, and he does have a therapist, but has been inconsistent with keeping his appointments. His parents also stated that he has lost weight and seems to be up most of the night. So we're going to talk about the depression. So what is depression? Depression, it is described as persistent and prolonged mood of sadness that extends beyond 2 weeks of duration. So you won't say a person is depressed if it's less than 2 weeks. That's just sadness. Depressive disorder does not experience episodes of mania or hypomania. Depression is also a chronic illness that may lead to emotional and physical problems, a feeling of lost interest. There are 2 types of depressive orders. First is the major depressive disorder, which occurs when a person experiences a depressed mood or loss of interest in most activities for a period of 2 weeks. Occurs as a single episode or recurrent depressive episodes. As mentioned earlier in the video, depression that occurs without a precipitating event is either associated with decreased neurotransmitter, which is the serotonin, in the brain and usually responds to antidepressant medications. There are also precipitating factors or circumstances, like what the case study mentioned earlier, such as loss of job, lack of support system, chronic pain, financial difficulties, or conflict with a friend or loved one. Another one is also for the seasonal depression, which is associated with decreased daylight hours during the winter months. Have you ever tried being depressed whenever it's winter?
Yeah.
Oh yeah, yeah.
Right?
All the time.
Yeah, mostly whenever winter or sometimes fall, I feel we feel sad because it's of the decrease of daylight. Another disorder is called the dysthymic disorder, which is a recurrent state of depression over a period of at least 2 years. This disorder is also the depressive symptoms become a part of the person's day-to-day experience, never disappearing for more than 2 months at a time, and this is less severe than the major depressive disorder. Clients or patients with this type of disorder has never had a major depressive episode and does not exhibit any symptoms of mania or manic behavior compared to the other disorder, which is the major depressive disorder. Okay. So the signs and symptoms will be explained by John Young.